Today we're going to talk about breastfeeding skills and planning. This presentation is brought to you by the UB Maternal and Child Health Program. I am Raymonda Adams. I am a certified lactation consultant and doula. Oh, okay. All right. Before you give birth, bling, the very first thing that you need to do before you give birth is have confidence. You got to get that confidence level through the roof and know that you can do this. This is what you were made for. This is how we're populating the earth. And you need to know in your mind that breastfeeding is something you want to do. You have to know and be comfortable in the fact that it's healthier for you and the baby. You have to get good prenatal care, and you have to believe that you can do it. What is good prenatal care? Prenatal care during pregnancy is very important. For your baby's sake and yours, it is important to take especially good care of yourself. Follow these basic rules. Eat a healthy diet, get enough rest, do not smoke, drink, or take drugs or alcohol, and schedule your first prenatal care checkup as soon as you find out you're pregnant. Prenatal care allows you to achieve good maternal health, normal development of the fetus, and to promote optimal labor and childbirth conditions. This way, maternal complications during pregnancy will decrease, as well as newborn complications such as low birth rate and other neonatal diseases. This one we were talking about the nicotine getting in the breast milk, so we'll talk about that later. Okay. Before you give birth, there are some key steps that you can take to prepare for breastfeeding. The first thing, of course, is get good prenatal care, which can help avoid early delivery. Take a breastfeeding class. Find a certified lactation consultant, such as myself, that you trust before you give birth. Discuss your health and medications with your physician. Tell health professionals in the delivery room that you would like to breastfeed as soon as possible after delivery. Talk to friends who have breastfeed or join a support group. Contact your local WIC office for nutrition and breastfeeding help and referrals. And always include a written breastfeeding plan to your doctors. That is a big thing. If you have a written breastfeeding plan, I find that they feel like you're more informed. So whenever you go into the hospital, you can say to the nurses and doctors, here, this is what I want. As long as I'm having a normal birth and delivery, this is what I want to do. And you have that right. Talk to your family and friends about how they can help. Let your partner, family, and friends know of your desire to breastfeed. They should be willing to show you love and appreciation. They should be good listeners. They should help you to get enough rest and have help around the house and help with older kids. Talk to your older children, if you have them, about breastfeeding and what they can expect to see and things that they can do to help you. Even something as just bringing you the bib or wiping the baby's chin will really let an older child not get the jealous feelings and feel like they're just being ignored. Talk to other family members that have breastfeeding experience and be honest about your fears and concerns, because breastfeeding, especially if it's your first time, this is something that's new. So it's okay to be a little afraid and apprehensive about what's ahead of you. Learning to breastfeed takes time and practice. There are some ways that you can make the process easier. Skin-to-skin contact is the big one. That's the baby directly against your bare skin. Breastfeed as soon as possible after birth. Barring any conversations, tell your doctor that you want the baby skin-to-skin contact because you make milk in response to your baby sucking at your breast. The time spent breastfeeding in your baby's first few days prepares your body to make a lot of milk. If there are any health concerns or you are having some complications, let them know that you want your partner or whoever's there to have that baby skin-to-skin with him. That helps babies regulate baby's temperature and his bonding. Let your baby stay in your hospital room. This is called rooming in. Most hospitals do that nowadays anyway. They want mom and baby to stay together. And tell the staff, should your baby have to go to the nursery for testing or any other procedures, tell the staff to not give your baby formula, sugar water, or pacifier unless it's absolutely medically necessary. Avoid all formula and avoid fake nipples until your baby is skilled at latching on, which can take about 3 to 4 weeks because that will avoid nipple confusion. Follow your baby's latch style of breastfeeding. Here's some tips on how to get started. Look for baby's hunger cues. Those will be rooting, which is the opening of the mouth and turning his or her head, fist to mouth, licking lips, sucking on the tongue, and very fidgety. Create a calm environment for your baby. Hold your baby skin to skin. Let your baby lead and don't force the latch. Some signs of a good latch when you're breastfeeding. Signs of a good latch are the latch is comfortable and does not hurt. Now keep in mind that sometimes when your baby first latches on, it can hurt because it will cause uterine contractions. That's perfectly normal. But once baby begins to suckle, there should be no pain at all. Make sure your baby's chest is resting against your body. Make sure you see little to no areola. When positioned well, your baby's mouth will be filled with breast. Your baby's tongue should be cupped underneath the breast nipple. You can hear or see your baby swallowing. Your baby's lips turn outwards and not inwards. Your baby's chin touches your breast. Mom is not hurting. Baby is drinking and swallowing, gaining weight, and very importantly, has enough dirty and wet diapers each day. Keep in mind that if baby is drinking and swallowing, gaining weight, has enough dirty and wet diapers each day, and mom is not hurting, then the latch is good. There is no such thing as a textbook latch. It's simply a reference. So if you're in some weird position, but everybody's comfortable and baby's eating, don't even worry about it. Here are a baby poop guide. So this will tell you what your baby's poop is supposed to look like at what point in his or her birth. There's all poop. Help with latch problems. First question, are you in pain? It really does take time to find a good breastfeeding position. So if you're in pain, gently break the baby's suction and try to relax. Are you or your baby frustrated? Take a break, sing a song, play a game, so that everybody can be calm and cool. Does your baby have a weak suck or make only tiny suckling movements? Break the suction and relax. Talk to a doctor if this does not work. Could your baby be tongue-tied? That's a very, very common problem. I had a mom whose baby was tongue-tied. Her breasts were hurt and cracked. It was crazy. And the initial pediatrician at the hospital did not recognize it. It wasn't until she went back to the doctor, literally in tears, that somebody even checked to see if that baby was tongue-tied. And in fact, tongue-tied, this thing, I forgot what it was called, but yeah, that under there, it's all the way forward and it's really tight up against the mouth. So yeah, isn't it crazy? And it's like the tongue, so it's kind of stuck, so the baby can't get it go. Right, can't get it good. So all the doctor has to do is boop, snip. So Janelle got snipped at a month old, and she has been a breastfeed fireball ever since. Crazy. Could have been avoided if they would have listened to her. Oh, you'll be fine. You're just tired. It's not, but that wasn't what it was. So be vigilant about your health care and about your child's health care. Yeah, they fixed it right in the office. Yeah. Just a 2-minute snip. They snip it. Snip. Snip. So some moms say that their breasts feel sore when they start to breastfeed. It does take time to find a good breastfeeding position and a good latch. It's possible that your baby is only sucking your nipple if it hurts. So gently take your pinky finger, break the baby's suction, and try to relax. Sometimes you just have to take a break for a few minutes and hold your baby upright, skin to skin, and then when you both feel ready and everybody's calm, you try it again. Getting your baby to latch. So what you're looking here is some different ways to get your baby to open wide to latch onto your breast. You can tickle the baby's lips to encourage him or her to open wide. Then pull your baby close so that the chin and lower jaw move into your breast first. And watch that lower lip and aim it as far from the base of the nipple as possible so the baby can take a large mouthful of breath. Baby's lips should be like this. That's how it should look when you're looking straight ahead. Okay. What happened? Okay. Here are some different, oh, bless you, different holds that can help facilitate your breastfeeding. The first one is the clutch or football hold. The second is the cross cradle or the transitional hold. The third is the cradle hold. That's a very common hold. Most moms are comfortable with this particular hold. Then we have the laid back hold, and then we have the sideline position hold. And that's great for in the middle of the night. When baby wakes up, you just lay that baby on the side and let him go to town and go back to sleep. Okay, so we're going to watch a little video on good positioning. This video has been developed to teach you how to position and match your baby for effective breastfeeding while your baby is sick. Before feeding, observe your baby for the following feeding cues. The early cues are stirring, mouth movement, and head turning towards what is touching the face. The mid cues are stretching, increasing physical movement, and hand to mouth. The late cue is a crying, agitated baby. Take the time to calm the crying and agitated baby before you attempt to latch. There are many different breastfeeding positions. The best position is the one that feels most comfortable for you and your baby. Breastfeeding may take time to learn. Every feeding attempt at the breast should be seen as a positive step in developing a breastfeeding relationship. If you have difficulty latching while assisted, lactation consultants are available by referral for extra support. Until breastfeeding is established, pumping will need to be maintained and coordinated with feeding attempts. It is recommended that pumping be done immediately after feed so that a full breast is offered to your baby. However, there are some exceptions and partial pumping before the feed is recommended. This could be the case if you have a large milk supply and/or if your baby is just beginning to breastfeed. Breastfeeding signs and screens are available for your baby to ensure privacy during the feed. Gowns can be worn as sweaters for comfort. A breastfeeding pillow or folded blanket can be used to bring the baby up to your breast level. If the baby's temperature is stable, it is recommended to feed in just a diaper to allow for skin-to-skin contact. This may also help keep the baby more alert and awake throughout the feed. If an accurate estimation of intake at the breast is required, please see the video on test weight. Taking the time to position the baby well will lead to a better latch and more effective feeding. For any position, the following are important. You should be sitting comfortably with your back well supported and relaxed. Baby's shoulder and body are supported with your hands and arms. Baby's head is at your breast level. Baby's ear, shoulder, and hips are in alignment. Baby needs to be tummy to tummy with you, except when you use the football hold. Your nipple should be pointed towards the baby's nose, with the chin coming to the breast first. If this is not the case, move the baby, not the breast. This will allow for proper positioning of the nipple in the baby's mouth, which results in a more comfortable latch and effective compression of the milk duct. Two positions that work well for babies who are first learning to breastfeed are the cross cradle and the football hold. Cross cradle is the most common breastfeeding position because it provides the baby with the most support and is easy to latch. See how the parent is sitting comfortably and well supported. The breastfeeding pillow raises the baby to the breast level so that the parent maintains good posture and the baby is well supported. The baby is on its side completely facing the parent's body with the ear, shoulder, and hips aligned. Notice the skin-to-skin contact. The baby is supported by the arm opposite to the breast being used. The back and the bottom
the shoulders are cradled with the hand. Do not hold the back of the baby's head, as this puts the baby in a difficult position to latch. The head is slightly tilted back so that the baby is coming to the breast chin first. This is often referred to as a slipping position. The parent's other hand is supporting the breast, and if necessary, the breast can be shaped to help the baby latch.
It don't hurt. It don't hurt. You feel like a little pressure. Your uterus might contract, but
the areola, the darker area around the nipple, so that they are not interfering with the latch. The breast is squeezed and narrowed enough for the baby to latch easily. This is often referred to as a sandwiching of the breast. Football hold is another common position and may be more comfortable after cesarean section. More pillows or blankets may be required. There must be adequate room for the baby's legs behind the parent's back. This may mean moving forward and to one side of the chair. There are two variations. The baby can be lying on their back or on their side. Either way, the baby is tucked in close to the parent. See how the baby's neck and shoulders are well supported with the parent's arms and hands. Notice how the baby has the nipple opposite the nose for effective latching. The head is slightly tilted back so that the baby is coming to the breast chin first. If needed, the parent has a hand free to support or sandwich the breast. The cradle hold is usually used for babies who are latching well and require less support and assistance to feed. The baby may be transitioned into the cradle position after latching in the cross cradle position. The baby's body is still completely facing the parent skin to skin. The baby's neck is supported in the crook of the parent's elbow, and the forearm supports the back, with the hand at the baby's bottom or hip. The other hand can be used to support or sandwich the breast. If extra support is required with positioning and latching, there are specialized positions and techniques available. Please put in a referral for a lactation consultant. Remember, the right position is whatever is most comfortable for you and your baby and allows for a good latch and effective breastfeeding. Try different positions to see what is best. Once the baby is in the correct position,
right, it is. It's long, kind of long, right.
to encourage baby to latch, hand express a drop of milk to give your baby a taste. Stroke your baby's upper lip with your nipple to encourage brooding, and a wide open mouth.
It is a great video.
Remember to break the contact between the nipple and the baby's upper lip to encourage the baby to tilt the head upward and open the mouth wider. Wait for a wide open mouth, as if the baby is yawning. Then bring the baby to the breast. Chin first.
Hi,
Do not stretch the breast or bring the breast into your baby's nose. Make sure the tongue is down and over the lower gum line. If your baby is crying, the tongue will be touching the roof of the mouth, and it makes it hard to latch. In this case, you need to calm the baby before latching. Usually, offering a clean finger to suck on for a moment will work. Otherwise, bring the baby upright onto your chest, skin to skin, and stroke the back gently.
Okay. Now we're going to watch a proper latch.
Once the baby is latched, look for the following: a wide open mouth. The angle of the corner of the mouth should be greater than 130 to 150 degrees, and the corners of the mouth don't touch. The baby's chin is touching the breast. Baby comes to the breast chin first. The head is slightly tilted back, and the nose is not touching the breast. The latch is asymmetrical. This means that more of the areola can be seen above the baby's top lip than below the bottom lip. The lips are flanged out. contraction difficulty, try sandwiching the breast. Breastfeeding should not be painful. The tip of the nipple needs to be where the top of the mouth becomes soft. Run your tongue along the roof of your mouth to where it becomes softer to feel how far back this is. When the latch is not deep enough, the baby has the nipple at the front of the mouth, compressing the nipple between the tongue and the hard palate. This can be painful and may cause damage to the nipple, as well as decrease the amount of milk flow to the baby. See the difference in the milk flow when the areola is compressed, rather than just the nipple. To break the latch,
Your face.
place the finger to the corner of the baby's mouth and gently push the jaw down. How do you know when to switch breaths? Switch breaths when excessive swallows are no longer observed to ensure that your baby gets more of the calorie-rich milk that is gone closer to the end of the feed. Remember to pump immediately after feed if breastfeeding is not yet established. Protect the milk supply. To ensure your baby is feeding effectively, please see the video on breastfeeding intake assessment to learn how to know if your baby is drinking breast milk at the breast.
Bam.
Once the baby is latched, look for the swallow.
Okay. What I do? Oh. This meeting will end. Oh. Where is it? There it is. Continue. Okay. Mine says waiting. No. A couple more. This one's long.
Is it a couple of videos?
No, a couple more. Your poor face. Oh my God. Okay. Your milk in the first few weeks. At birth, is colostrum, which is a thick yellowish fluid. It's in small amounts and it's good for early immune protection. 12 to 24 hours after birth, they will drink about 1 tablespoon of colostrum per feed. 3 to 5 days after birth, mature white milk begins to come in. And 4 to 6 weeks after birth, white milk will be in. Note that breast milk is not always white. They can change color depending on what's going on with your body. Example, greenish tint in the milk may be caused by spinach or herbs you may have eaten. Dyes and things like soda or Kool-Aid can also tint your breast milk. Contact your doctor if there is any major concern or possible infection. Is your baby getting enough milk? Your baby will be content and gain weight steadily after the first week of life. Your baby will lose a small amount of weight the first few days after birth. Know that this is normal. After this, though, your baby should gain 2/3 to 1 ounce each day until he or she is 3 months old. Baby should have clear or pale yellow urine. Your baby should have regular bowel movements, and you can refer to the poop chart from earlier. Your baby switches between short sleeping periods and awake periods, and your baby seems satisfied after each feed. Breastfeeding can be challenging and stressful at first, but remember that you are not alone. You have family, friends, and professional support to help you. A common challenge that happens with breastfeeding moms is low milk supply. So, in order to combat this, you need to breastfeed as often as possible and let the baby decide when he or she is ready to stop. Make sure your baby is latched on and positioned well. Use both breasts when feeding. Avoid formula, cereal, and pacifiers. The only thing that your baby needs the first 6 months of life is your milk. And talk to your doctor if you have any concerns. Cluster feeding. When it feels like your baby has hijacked your breast and your baby is sucking the life out of you and your baby is feeding nonstop, this is called cluster feeding. This is very normal and it can be frustrating, but it's only caused by growth spurts that your baby may have. Slower milk flow can cause cluster feeding. Fluctuations in hormones can cause flux, cluster feeding, and reduced amount of prolactin. Sore nipples. Improper latch is usually the main cause that leads to sore and cracked nipples. Breastfeeding should always be comfortable and it should not hurt. Your own breast milk also has healing properties. So if your nipples are getting sore or cracked, just gently rub it on your own breast milk on your nipples, and it definitely will heal. Breast milk heals. In my experience, it also heals ear infections. It heals pink eye. There's also some good stuff in breast milk. Don't delay your feedings because this can cause more pain and harm your milk supply. Get help from a lactation consultant. Change positions each time you breastfeed. Avoid harsh soaps and ointments on your breast. And don't wear bras or clothing that's too tight. Some remedies for sore nipples are applying freshly expressed milk to your breast, warm compresses, medical grade 100% lanolin, change your nursing pads frequently, let your breast breathe, and ask a medical professional before using creams, hydrogel pads, or nipple shields. Another common challenge for breastfeeding moms is engorgement. Engorgement is when breasts become hard and painful. This is usually caused by milk buildup. Swelling, tenderness, warmth, redness, throbbing, and flat nipples are all signs of breast engorgement. Some of the causes of milk buildup are not breastfeeding enough. Sometimes moms wait too long between nursing or pumping. There are fluctuations in yours and baby schedules, like going back to work, or sometimes moms just have an overabundant milk supply. It's normal for your breast to become larger and sore while breastfeeding, but the consequences of that, if it's not taken care of, is it can cause fever or infection. Some solutions to help you with breast engorgement are to breastfeed often after giving birth. Let the baby feed as long as he or she wants. Breastfeed on the effective side to remove milk. If you do return to work, pump your milk as often as your baby feeds. Use a cold compress to reduce pain. And on the flip side, a warm shower or warm compress stimulates the letdown reflex and gets your milk to flowing. Work with lactation experts to improve your latch. Wake a sleepy baby for feeding. A lot of people say no, 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 but you should absolutely wake a sleeping baby for feeding. Hand express your milk or breast massage. And in this slide, these are just 6 engorgement holds and massages that you can do to help relieve that pressure. Breast infection, called mastitis. Mastitis is the soreness or lump in the breast. It's usually caused by blocked milk ducts due to incomplete feeding. Bacteria enter the breast through cracks in the nipple. Symptoms of mastitis are fever or flu-like symptoms, nausea, vomiting. Breasts are warm or hot to the touch. They may appear pink or red, and there may be yellowish discharge coming from the nipple. The breasts are very tender. There's some swelling, pain or burning sensations, and there's thickening of breast tissue and lumps. Some solutions to mastitis are breastfeed on the affected side every 2 hours or more to keep the milk flowing. Massage the area regularly. Apply a warm compress to the area. Get extra sleep or relax. A breast infection can occur if mother is doing too much and is overly tired. And see your doctor right away if both breasts are infected, if there's pus or blood in your milk, there are red streaks on the breast, or you experience any sudden and severe symptoms. Nursing strikes. Nursing strikes is when your baby suddenly refuses to breastfeed. It can be due to baby's pain or routine change. It could mean that your baby is trying to let you know something is wrong. It does not mean they're ready to wean. Some causes may be mouth pain, such as teething, fungal infection like thrush or cold sores, ear infections because sucking increases the pain. There's pain, there could be pain in certain feeding positions. They could just simply be distracted while breastfeeding. They might be getting less milk from mother after supplementing with formula, and there may be pacifier overuse, stress, or overstimulation. Solution to your nursing strikes: express your milk as often as your baby is used to feeding. Try giving your baby breast milk through a spoon, cup, or dropper. Continue to offer your breast to the baby. Provide the baby with extra cuddling and touching, and breastfeed while rocking your baby in a distraction-free room. Common questions. Should I supplement with formula? No, unless the doctor recommends it. Formula will cause your baby to not want breast milk as much, which will lower your milk supply. Does my baby need cereal or water? Your baby needs only breast milk for the first 6 months of his or her life. Other substances can cause your baby to want breast milk less. Even when it's hot, your baby does not need water or juice, just breast milk. Is it safe to smoke, drink, or use drugs while breastfeeding? If you smoke, it is best for the baby and for you to quit. It is still better to breastfeed, though. Do not breastfeed if you drank a large amount of alcohol recently, and it is never safe to breastfeed your baby if you use illicit drugs. Can I take medicines if I'm breastfeeding? Certain medicines are safe to use while breastfeeding, but some are not. Many medications can be passed into your breast milk, so you must consult your doctor before you take any medications. If you are sick with the flu, avoid being near your baby to avoid spreading it to them. Have someone who isn't sick feed them your pumped milk. Do not breastfeed your baby if you have HIV or AIDS, untreated tuberculosis, infected with type 1 or 2 human T-cell lymphotrophic virus, if you receive chemotherapy, or if you are undergoing radiation therapy. Can I breastfeed if I am sick? Most illnesses, including colds, cannot be passed through breast milk. Breast milk actually has antibodies that help protect your baby from illness. And again, if you are sick with the flu or have HIV or other untreated diseases, please do not breastfeed your baby. Does my breastfed baby need vaccines? Yes. Vaccines are very important to a baby's health. Breastfeeding can help your baby respond better to immunizations, and mothers may also receive vaccines while they are breastfeeding. Can breast milk have toxins from the environment? Certain chemicals can appear in breast milk, but breastfeeding is still the best way to feed your baby. The known risk of not breastfeeding far outweighs the risk of environmental pollutants, unless you live in Chernobyl. What if my baby bites me? Put your finger into the baby's mouth to take them off your breast with a firm no. Try not to yell to avoid scaring him or her. Gently press your baby to your breast. This will cause them to open their mouth to breathe. Stop feeding right away so your baby does not try to get another reaction from you. Offer a cold teething toy before breastfeeding to soothe your baby's gums. Put your baby down for a minute to show biting has negative consequences. And as always, if you need any help, reach out to any one of the professionals, family, or friends that are around you on a daily basis. The end.